welcome back. Hope you are refreshed. I hope you voted. And I hope you enjoyed all the creatives from the team called Visuality who've been helping out today. For our last session, we're going to be considering how we can go mapping the way towards an EU health union. We have 3 guests in the studio here, and we have 2 online. I'll introduce our guests here, just to make sure there's time for our online guests to join us. And thanks again for everybody who's rejoined us online as delegates to this event. I'm very pleased to welcome Anke Thome. She is the Executive Director of the European Patients Forum, come all the way from down the street, Brussels. Ingrid Keller, lovely to see you. Head of Health Security Unit at DG Santé, European Commission. I thought you might have come from Brussels, but from this morning you've come from?
Luxembourg.
Luxembourg, so all the way. And I think we know Nathalie Moll, co-chair of the EU Health Coalition, also Director General of EFPIA. And online, 2 gentlemen. Lovely to see you. We can see you, and I hope you can hear us. Online, we have the Deputy Minister of the Ministry of Health of the Czech Republic, Jakub Jorovarešek. I do apologise. Let's get that clear. Vorešek. Very good to see you. Can you hear us, sir?
Yes.
Raises a pen. I think so. And also, Professor Mauro Mare, who is the director at the Centre on Welfare at the Lewis Business School, a former economic advisor to the Minister of Economy in Italy, and a former visiting professor at Harvard University. Welcome to our panel. And again, do put your questions on Slido. Do raise your hands here in the hall, because we'll take as many of those as we can. And I think we have a little problem on the technicalities there. But the tech team, headed by Dries, who's a wonder, will sort it out. So we'll start here in the studio so that we can make sure that we've got that connection established. So it would be really helpful to get an idea from our panel, having heard all those other discussions about particular aspects of the recommendations that you've come up with. It would be lovely to hear about how this is all going to come together. Ingrid, if I could come to you first on that. How do you think, talking about data that has come up today, I know you've not been able to be here for all the sessions, but it's been discussed that we need data. We need to be able to measure health outcomes and build that into policy. So how important do you think that could be to try to do that?
Thank you very much, Sue, and hello, good afternoon, everybody. Thank you very much for having me on this panel. Very happy to be with you. Somebody said at some point, what gets measured gets done. So I think this is very true and very important. So I would certainly support any data collection. I know that sometimes the GDPR is in the middle between the data and us, but this should not always stop us from collecting and actually measure what we are doing. I'm coming from the health security field, as you said, so for us, being able to have the right data at the right moment, and we saw that in the COVID pandemic it was not always the case, is really, really important. We need early data. We need to see outbreaks early in order to stop them, in order to not for an outbreak to evolve into a pandemic. So yes, fully support your call on good and better data.
Thank you. And Anke, from the perspective of the patients, what would you say is the importance of embedding some of the new technologies? I know that your organization has on its website launched an AI knowledge hub. You're right up there leading the way on this. What engagement are you getting from patients? Are they ready to accelerate the uptake of digital transformation?
Well, the short answer would be yes. Our AI Knowledge Hub is built specifically to support the digital transformation in the patient community. Our members are very interested. I can plug our next AI webinar this week. We have an AI webinar. We are doing a series of webinars also to support the Knowledge Hub, which is a lot more technical, more scientific. It looks much more into depth into the issue. But to support that, we're doing a series of webinars to really build this basic knowledge, the layperson's understanding of AI. We have a series of webinars. You can watch them on our website, the past ones. There's 2 upcoming. what more do patients need? I think the most important is sustained structural investment in capacity building, because you don't just do digital transformation once and it's done. This is a technology, it's a framework that is evolving constantly, so that engagement has to be sustained.
And I'm really interested because on one of the other panels, actually, one of our other speakers said that patients and caregivers are not ready. There is some resistance, or perhaps elderly. I certainly know with elderly relatives who mother can't reply to an email. There are issues there. So, and then other times we're hearing that patients do want to engage on a lot more, maybe the younger patients. So how are you doing that? I'm really interested to know, and I'm going to tune into your webinars, about how to then engage in AI, because perhaps some people are a bit fearful that it's all very complex.
It is complex. It is complex, and this is the reality of the future. I would say that the digital literacy divide goes very much hand in hand with other inequalities in society. So I think addressing that is it's a much more integrated issue than one would think. The digital access inequalities are very, very linked to the other health inequalities, to the social determinants, to the economic determinants, to the educational gaps, and so on. So, in order to bring the whole of society, you have to work on the whole of society. We are working on the patient organization community. And I fully recognize that is it's a set of stakeholders that are already organized and ready to go. And then we hope that by bringing them along, they'll be able to bring their constituencies along. But for that, again, sustained investment. That's really, really necessary.
Yes, that investment. So, and Natalie, then, you're here with two hats on, not only as co-chair of the coalition, but as Director General of this pharmaceutical organization. So what role do you see of industry in trying to bring to fruition this EU Health Union?
So I think that we've been talking about so many things today. I was about to say this morning, but it wasn't. It was the whole day. And all the different pillars of what makes a European health union. And I hope, that now that we've illustrated the recommendations of the EU Health Coalition long and large and discussed them, that they're kind of integrated. But it struck me in a conversation with one of my colleagues who said to me, well, there is no European health union without innovation. And this is something that I think it's easy to forget because we are quite spoiled in Europe. We've always had incredible innovation. We have wonderful universities, we have hubs, we have lots of SMEs, we have the same amount of patents as the US. We're not fantastic, as we heard during the course of the day, at transforming that innovation into products on the shelves or in the hospitals. We got a little bit of a valley of death there. But I think we take innovation for granted. And I have to say, looking at the data that, like I said this morning, that we published this week, if you look at R&D investment globally, Europe has lost a quarter of its investment in the last 20 years, which means that investment is going somewhere else. And it's very hard to bring it back. And if we don't reverse this trend, we will be innovation consumers rather than innovation producers. And I think we were so lucky during the pandemic to have BioNTech and to have lots of the companies that were coming up with the solutions. And I would hate to have been in a situation where I was waiting for another country to very kindly share their vaccines when and if they felt like it. And it's not only in situations of crisis, of course. I think we in every single element of the recommendations, there's innovation. In integration of healthcare, there's innovation. In R&D and innovation, in access, we need to innovate the way we do that. So in every element, I think if we do not realize that we need to protect innovation and boost innovation to have everything else, then we will be left with lots of very good policies to do doing what with what, what is the essential element. So I think it's really a fundament for us, and our industry is focused on innovating to meet unmet patient needs, unmet health needs, in collaboration. So I think this would be maybe the biggest element that we can bring as an industry, is that innovative base.
Thank you. I'm hoping that our online speakers are able to join us. If they are in the tech team, can wave them up there. I think our speakers are taking a little rest at the moment while they battle with the gremlins. So what I'd like to pick up, though, Natalie, was the point that Anka made. She talked about the need for investment to get on track with digital. And I'm wondering, is there, in terms of being innovative and thinking out there, is there a role for industry in helping to educate, to fund, to train, so that people could have these skills and the inequalities that were touched on, whether that's the hardware or the software, the training? Is there something that industry could do to help invest in that side of it?
So I think when we were working on the recommendations, we found so many European instruments that could be used to have that sustained investment, whether it's in data infrastructure, whether it's in healthcare system integration. I mean, there really are so many. And what you said, what gets measured gets done. We need to see that those investments, whether it's, for example, EU for Health, there's a lot of things that there can go back. The RFF. I mean, I think there are things that we can channel. The important thing is that it's sustainable. If we do it as an industry, it'll be, local and country by country. And here, this is such an important objective of leveling up, whether it's digital or other areas from our recommendations, that it really needs to be this coordination of European policies that we have a lot of, by the way, right now. We have the pharma strategy, the industrial strategy, we have the Recovery and Resilience Fund, we have the EU for Health, we have, a series of strategies that we would need to really decide where we focus them and measure the results of that investment. And that's, I think, the background to our recommendations, is really to try and say, this is what we see as a healthcare community as 9 areas we need to work on for the next number of years. Please, can you focus here? Because otherwise we just, sprinkle here and there, and then it's not sustainable and it's not impactful either.
And in terms of measuring, actually, I'll let you into a little secret. Natalie and I were at another event not long ago, where there was a fantastic presentation about the economics, about the statistics. One of the figures that was given was that 11% of Europe's wealth is created by the health sector. And he gave some equivalents to the automotive industries in Germany, for instance. So he was again making the case for health being seen not as a cost, but as an investment. So Ingrid, thinking about that, picking up that point about measuring it, once you value the what's going on in healthcare there, does it need a mindset change to appreciate this? What will it take for us to understand the figures and to translate that into an impetus?
Well, I would actually start before healthcare, because I think the best for any patient is not to become a patient. If you can stay healthy, that would be even better than being cared for. So this is why the issue of prevention is so important. I mean, as I said, I unfortunately couldn't be with you for the whole day, but before integrated care, you have prevention. And I think, you named a number of policies that are being developed, but what's missing, and which is a really important part of the EU Health Union, if you look at how we coin it, is the whole package around health security, which comes with a new impetus, because we saw that during the pandemic we couldn't manage, at least in the beginning, we were not as prepared as we thought we would be. But so we not only want to be better prepared, but we also want to be better in preventing. So, and also prevention, I think in previous years has been always seen as, we have to do it, so a little money here, a little money there. Mm-hmm. But it's not investing in health, meaning preventing bad health. This is really good investment. And I think this is something that the pandemic has shown. And this is, so let's keep riding on this wave. That's very important now that, we don't wear masks any longer, people think we are getting to the end of the pandemic. I think the figures say yes, but you never know. So I think we need to be a bit cautious to also still keep this prevention angle very strong, be it the prevention of chronic disease or the prevention of the infectious diseases. But I think prevention is also a really important point to be considered.
And indeed, in the integrated care session, that took that broader view. One of the points, we started this conference with a video from the Commissioner, Stella Kyriakides, and I've heard her before talk about the importance of collaboration, of trust, and of vision. Natalie, you certainly got vision in those 9 recommendations there. That collaboration aspect as well that's come up over and again in the sessions today, the partnerships, working together, cross-border and so on. How important is the collaboration side of it, especially with all of these stakeholders here today?
Yeah, so I think we are ready, and that's, the proof is in the recommendations. These ones, the ones we made 2 years ago in the middle of COVID, the first ones we made in 2018. I think there is collaboration and alignment among the stakeholders, whether they be academic institutions, regions, hospitals, nurses, industry, and patients. We certainly have collaborated to tease out what is absolutely necessary. But if you don't have on the other side the institutions to have that conversation with, it becomes difficult. And of course, Europe is very complicated. We're 27 member states with completely different healthcare systems. And then we have lots of European institutions. We have the WHO Europe that we heard this morning. And for us, in the launch of our recommendations today, we were saying, could we not have a bit more policy priority on health? So, the policy priorities of this European Commission at the beginning were the digital and green transformations, which makes sense. But surely, having learned from COVID and now with the war in Ukraine, but especially having learned on COVID, surely healthcare could be the third foot of that stool. And why is it important? It might look like just words, but actually it's fundamentally important, because when you can focus attention, political attention on an objective, then that collaboration has somewhere to go. Otherwise, it's just fixing little things at a time. And this is what, one of the things that makes me sad, which I shouldn't, but is that everybody's forgotten what happened during COVID. Those first weeks when we couldn't get trucks across borders, we couldn't, cross-border workers couldn't go, and we were all scratching our heads at clinical trials. People weren't going to hospital anymore. I mean, it is for me an unforgettable moment, and we worked together so incredibly well with policymakers to find solutions, really very concrete solutions, and I'm sure that we can build on that trust without forgetting that health is still really important. Without health, you don't have digital, green, anything. You don't have anything without health. And one of the speakers, I think, said it this morning. So that would really be a little bit my plea of saying, yes, collaboration, but at the right level, with the right focus to make things happen sustainably.
And Anke, you've written before, I was reading, you said that a European health union must be built in equal partnership with patients and citizens. So echoing or picking up from Natalie's points there, how best would you want that to be achieved?
We've already gone pretty far in creating this partnership with patients and citizens. And I would build on what Ingrid and Natalie said earlier. I think the European Health Union is about integrated health, not just care, integrated health. It's about health in all policy. It's about collaboration and trust and vision. And we have seen that this works. When we say that patients need to be equal partners, what we mean is that we would like to go beyond talk of patient centricity, beyond talk of patient empowerment. I'm talking about having the same seat at the table. I'm talking about having this co-creation embedded in a structural way in health systems that go beyond the healthcare system, because you don't just achieve health in your health ministry, in your hospitals, and in your primary care. You achieve it in your agriculture, in your industrial policy, and in your finance, in your fiscal policy, and and patients, citizens, need to have a seat at that table where the decisions are made, even though as individuals they don't represent a major economic player, even though as individuals they don't, but they represent something bigger, which is the population for whom our systems work. And that's the whole point, and that is why they have to be equal partners in this. There's the first-hand knowledge of their lives, of their conditions, of their lack of conditions, of what they need, of what works for them. It's their primal knowledge of life that we, I think, in our, in our conferences, sometimes we forget that we're all people, and that is the important part of this partnership.
And I think that was touched on earlier, was it Andres Rees saying that we're all patients, we're all citizens, so the overlapping of that, and perhaps even thinking about the language. I do want the audience here to have the opportunity to put questions to our panel. There is a chance we'll get our other two speakers back online. I know they're beavering away over there, sticking bits of wire together. But meanwhile, please do raise your hands in the hall here if you've got a question that you'd like to put, and or you can pop it onto Slido and we'll pick it up here. Because we're trying to round up this afternoon some of the sessions that you've been hearing throughout the day and draw it together as to how this can be taken forward. And you, the delegates here, are all stakeholders in some way. And it would be lovely to hear what you've got to say, any comments, or also any questions that you'd like to put to our panel here. And you've all just flagged at the end of the day. One thing that I found that came up a few times earlier, it was interesting, wasn't it, when we talked about healthcare workers and the importance of this, and try to recognize that there's a crisis in the healthcare workforce right across Europe, where some have got demoralized by working through the pandemic or working conditions and pay. And so, Ingrid, it's something I'd like to put to you. How can that issue about remotivating or overcoming the demoralization of the workforce, how can that be addressed to make sure that in an EU health union, the workforce is recognized as a central key ingredient?
I think what you just said, Sue, is really true. I mean, the workforce is a central key ingredient, and I think we need to appreciate this very much. And I think in the bits and pieces that we are putting together, the different legislations, be it the Europe Beating Cancer Plan or the new regulation on cross-border health threats, or also the EU digital health data space, it always has the horizontal issue of health workforce in their training is obviously key, because also, I mean, we said this earlier, the digital divide is not only necessarily for the patients, but we can also be at the level of workforce. So training, living up to the new challenges, and the training can obviously also be a support in bearing with the additional work that stressful situations like COVID can bring. And if I can add this maybe, because next week we are going to have a big conference on COVID lessons learned in Luxembourg. You can also follow it online. And we have a very much dedicated sessions only to healthcare workers. There, we wanted to hear from them. We have a nurse, we have a doctor, we have a lady running a care home for older people. So we really wanted to put them in the forefront, also in the lessons learned, and hear from them what would they need. So I think that's very important to listen to them and bringing them into the fora, because it's only them who can really tell us what they need. I mean, we make the larger scale policies, but how we then reach them best with that, I think it's important to really listen to the people from the field.
Thank you. And I'm wondering if in the room here, we have a few questions. I was thinking there might be some healthcare workers. Gentlemen there, if you'd stand up and say who you are, please.
Yes, good evening. My name is Nicola Montano. I'm a representative of the European Federation of Internal Medicine. So I'm a physician and academic. And just to go back to this point of the workforce, and I have to say that in this moment we are really worried, because we really think that the biggest problem for the healthcare system in all Europe is the workforce. And just, I would like to summarize what I heard today with a simple example of what we lived during the COVID. I was a director of a big ward in Milan, so we were badly hit. But during the first wave, we were so motivated, with such an intrinsic motivation, that we really did not feel any fatigue. You know, of course, was a lot of fatigue, but it was a motivation. No one left. No one left. And the silos broke, because I was used to work with cardiologists, orthopedics, surgeons. That was an unbelievable example of what the world could be and how we could work. Then the second wave came, and that broke our legs. Why? Because the bureaucracy, the administration came back to us. So the problem of our problem is that, there is a huge difference between the need of our patients and the health system. So there is a different speed. Okay, so our patient changed so much in the last 10 years. We are trying to follow, but the healthcare system, they are really bringing us to the ground. And for us, this is really frustrating. This year, we are facing an incredible leaving left of the physician from the emergency department. And so all the internists and other physicians are requested to go and to take care of the emergency room, and this is creating a fallout of physicians. This is one big problem that we are not facing. So there is from one part, there is a complete mismatch between us and how the health system works. From the other part, we are really following our patients, but the need of our patient, sometimes we cannot respond to all of them. So it's really becoming difficult.
Thank you for that comment. And rather than put it to the panel, I would like to put it back to you, sir. What would you, if you could hold on to the microphone, do you have an idea? Maybe it's localized to where you're working, but what would change that? What would make a difference?
Yeah, there are many things. It's very complex questions, and this is what we are really thinking about. And there are different levels. There is an economic level from one side. That is the recognition, as you said before, the recognition that as a workforce, as a fundamental profession in our countries. So a recognition that, when during the first wave, everybody calls us heroes. We have just heroes for a day, as David Bowie said, okay? But then everything was just forgot, okay? Even the politicians, they were they asked us, and they were so proud and keen to help, but then they stopped. Okay, so there is this kind of recognition that we need. From the other side, the healthcare system has to be modified according to the needs of the patient and the physicians, because the patient-centric core is the patient-physician core. So we have to work in the best condition to help our patients. And this is what we did, what we want. And all the problem that we have right now all over Europe in recruiting physicians working in the hospital, and the Telegraph published 1 month ago in England a survey by the National Health System, and the title was, in 10 years we have to close 50% of our hospitals. So we want really struggle, and I'm very happy to be here, because I think that there is another point that is an educational point. The fact is that all healthcare system has always been flown above our heads. We have never really had the governance of this. I'm talking about of course, my country, and maybe other country that I know. So if you don't decide, how can you break the silos? How can you motivate your workforce to work in a different way if you are just the last part, are the professional that is requested to do, and not the one that is the one to share, that is asked to share the decision. This is very important.
Thank you very much for that. It's interesting to hear from the front line there. And Anka, you're nodding. It seems to resonate with you from the patient perspective.
Well, very much, because patients and doctors and their healthcare professionals have a privileged relationship, right? For patients is the first interface. And I would say, I don't know, a few things. I'll throw them out there. The first is that I am not aware that in any country in the EU, the salaries of healthcare professionals are appropriate to their skills or, years spent in training. I am also aware of research that says that in 10 years we'll have major shortages across all specialties of healthcare professionals. And then the third thing is we need to build the systems from the needs up, not from the resources down. And you have to start with the needs of your population to keep them healthy, to keep them healthier or as healthy as they can for as long as you can. What do you need to do that? You need services, you need people. And if your societal values are aligned with your needs and are the basis of your healthcare system, and I'm not, again, aware of anywhere in Europe where that happens, and that happens systemically. And I think this is the lesson that we fail to learn. You cannot ride on people's adrenaline in the first wave. Because, no, you can't, and motivation. And, of course, you all want to help, but eventually we run out of steam. And so you can't do that. I mean, and then economic crisis is going to hit healthcare professionals like it's hitting patients. We have catastrophic healthcare spending in many countries. Prices are rising. It's going to be a very tough winter. And we must learn to put the needs and the values first.
Thank you. There were other hands up for questions. A lady in the second row there. Thank you again. If you'd be kind enough to say who you are.
Oh, thank you. My name is Pernilla Gunther. I'm the president of the European Patient Safety Foundation, and I'm also a former member of Swedish Parliament. And I would like to combine these two positions because health is a national priority. I mean, the decisions are made at the national level. Mostly. And maybe the European Commission comes sometimes with directives and we should follow them in the countries, but there are no follow-ups. And I think that is an issue also to be raised about patient safety. You should not get an unequal care between the European countries because you have no follow-up from the EU Commission. And I send that message right to Ingrid here, because I have a third position, and it's a member of the Cancer Mission Board. And we're really struggling now to get, cancer hubs all over Europe and try to really implement the cancer strategies and the beating cancer plan and so on. But if people are not understanding that they have to drive the change from the ground, the patients, the citizens overall, and the organizations together at the national level, then we can have another health summit within 10 years, and we still haven't got very far.
Let's put that to Ingrid then, because we've heard earlier today that there were all sorts of things going on. It was fantastic to hear members of the Commission telling us about all the things that are happening. Ingrid, no follow-ups. You put out all these policies and mission statements and things, no follow-ups. Why not?
I don't know. No, I'm a bit surprised. I mean, show me a European policy that doesn't have, even though maybe at the very, very back, Article 122, evaluation to be happening in year X. So normally all the action plans, at least those that I know, do have a paragraph at the end saying, well, first of all, especially if it's a directive or a regulation, the Commission must report by day X to the Parliament and the Council to see how everything is going. And then also, in addition, evaluation has to be done, I don't know, in 2 or 3 years. Sometimes, at least in what we are working on, the cross-border health threats regulation, we need to be done with the first evaluation already in 24. So we basically only have 1 year to implement. So, which is a very calm year, no major outbreaks, so that we actually can focus on the implementation and that the countries can focus on the implementation, because preparedness, as you just said, also like healthcare, is happening in the countries. And we can set a frame, we can make suggestions, but the actual preparedness work is happening in the countries. And but that's if I can maybe go a bit beyond care here, that's a big innovation in our new cross-border health threats regulation, that we are, with our European Center for Disease Prevention and Control, go actually to the countries and assess them. So what I said before, what gets measured, get done. So the ECDC actually has now a mandate to go, not every year, they will not make that, but every 3 years to the countries and say, show me a preparedness plan. Where's the implementation? That hasn't been there before. So that's actually thanks to COVID, where everybody said, I mean, you rightly said so. You know, borders were closed, no PPE. But we do have now the actual tools to work better and to be better prepared. Obviously, it needs to be done, but we also have the tools to measure it.
Thank you. You have the tools. You've got a promise it's going to be followed up.
Sue, can I
Yes,
mention something?
definitely.
Because one of the recommendations of one of our 9 recommendations, the EU Health Coalition, is to set up a monitoring centre for innovative health technologies and clinical practices. So maybe it could be part of the Joint Research Centre using EU for health funding. We're already giving you a whole package, but that would be a way of checking a number of things, doing the horizon scanning to see what's coming along the way, but also doing that monitoring and benchmarking of uptake of new clinical practice or new innovation, so that you can keep a track of what's happening on the ground. Because I agree with you that it's hard to, whereas on individual policies there's a check every 5 years, I think you also have to do an analysis. I think that we can do more. Like, certainly as far as our coalition is concerned, we believe that if we could give every member state a picture of what's happening and somewhere very easy to find out, you know, what's coming and how different countries are doing, and as soon as you know what the obstacles are, you can start working on them. So that's a very concrete recommendation that we have as part of the 9 recommendations.
Thank you. And I want to say we're very, very sorry that our 2 guests couldn't join us online. The mouse or something has eaten a cable, I think. Very, very sorry. It was lovely that they were lined up. But I'm really grateful to our 3 speakers here. And I'm going to ask them to finish. What difference would it make if this vision of an EU health union becomes a reality? What difference would it make to citizens across Europe? Anka?
I'm sorry, is that a rhetorical question?
No, it's one requiring.
Well, I think
answer. What do you think?
me,
is it philosophical?
No, it's hopefully we're all here because we agree on the difference that this would make, which would be that Europe would have healthier, productive, or more productive.
Productive is good.
No, but people don't like to be sick. People like to be productive and active. So I would want to see the result of the European Health Union: a healthier, more productive, more active population, and overall a better welfare. That's.
Sounds pretty good. Ingrid, what difference would it make to have this EU health union?
Well, I think what is important for citizens, what we have seen also in the past year, is that, and this is the recommendation in the middle row on the bottom, at least how I see it, a coordinated union to give the same message. Because we have seen, especially once it came to vaccination, get vaccinated now, get vaccinated later, get vaccinated if you're old, get vaccinated if you're young. That's not good. Or you go cross-border to get your vaccination. This is not good. So this is really something I personally would like to work more with member states. It's not a very easy task, I can tell you, that we can make 27 agree to give the same communication and also risk communication messages to the citizens, very crisp, very clear, so that there's no confusion. Because why? I mean, with internet, it's so easy to check what are other governments saying, or what are the I mean, if it's different groups, that's something else. But especially at government level, I think it's really important to speak with one voice and give the same health-related messages to the citizens. And we know, I think in the panel before, they said citizens are expecting more health from the union. So I think they would look at these messages also maybe coming at union level. Because if I get the authority from the members, I can communicate, you know, in all languages to all of them, but we need to agree on the messages first. That would be great.
And when this was kicked off 4 years ago, Natalie, you were saying you started with some 20 recommendations, boiled them down to 9 today. Can you boil it down to one key message now? What do you think would be the benefits of the real creation of an EU health union?
So if the EU Health Union contains all 9 of our recommendations, I think that we will reach a more efficient, more effective, more impactful care for all. I think this is what we're looking for, that more efficient, more impactful, more effective care for all. I think this is what we're looking for. And in there's equality, access, innovation, you name it. But at the end of the day, that's really, I think, what we're all looking for. And maybe I should say sustainable as well. But if it's efficient, I suppose it's sustainable.
You packed a lot into that. Well, thank you so much. What a great panel. And again, our apologies that our 2 gentlemen were not able to join us. But what a day it's been. And I'd like to thank Natalie and Lynn as co-chairs of the EU Health Coalition for everything they've put into this to drive this vision forward. And Lynn was saying earlier, it was lovely to hear, she felt that there was a real momentum today, a real energy she's felt in the room from the patient's perspective and all the stakeholders that are here, and wants everybody to capitalize on that momentum and take it forward. Another gentleman was asking about evaluation forms. Those will be sent out to all the delegates, and we want to hear your comments. There'll be all sorts of issues that you'd like to feed back on and think about, and do let us know. So when those feedback forms come to you by email, I believe, do fill those in, because we want to take this on. There's so many partners involved. I would love to thank everybody who's been involved today. We've had the most amazing panels of speakers. I've been absolutely in awe at some of the caliber of the speakers we've had today. They've made such vital contributions to the debates. We're grateful to the Flemish Parliament for having us here, hosting this event. What a lovely, lovely venue. And also very grateful for everybody who's joined online. You're still with us. And of course, everybody who's still here, I can feel the energies flagging a little bit. Don't worry, there are cocktails coming. But thanks for staying through. And thank you very much for everyone who has voted on those recommendations. It'll be really interesting to see which ones have been voted up to the top. So there's been a real strong sense, I've felt, of community. I felt that among you all, talking to you. And that's been a really fantastic thing, that sense of partnership, that sense of collaboration that we touched on earlier. Now, I understand that next year the EU Health Coalition is going to focus on following up these recommendations through engaging with policy makers, stakeholders, and continuing to build awareness through online. So do keep looking online, keep up that momentum. And it has been my great pleasure to be with you today. Please do join us at the cocktail reception. Everyone online, you can raise a glass to the new EU Health Union. And I want to thank everybody today. It's been an amazing day. Thank you all.